Okay. So thank you everyone for coming. I'm Gigi Decavalis-Hughes. I'm the Director of Finance for the city. This is the third meeting that we're having with our community, our business and nonprofit community. This is the nonprofit meeting. We've had 2 meetings with the business community. And we're here today to talk about the upcoming item that we're going to be bringing in front of our city council on a minimum wage increase. In June, the City of LA passed an ordinance that is increasing the minimum wage in LA, and our council directly came to us and said that they would like us to draft an ordinance as well. We are recommending an ordinance that aligns with the City of LA ordinance in terms of the progression of the wage increases, the amount of time that it's going to be taking us to get to that target of $15 an hour, and the deferral period that we would be expecting for certain businesses or nonprofits, and some that have some additional circumstances. Another thing that we're including in our, or that's pending right now in our proposal or in our ordinance is some things that LA still hasn't decided on yet. That has to do with paid sick leave, the collective bargaining exemption, and I believe that there are certain transitional program aspects to the LA ordinance that we might have a little bit more information today. I think some of you here are also in LA, so you could actually give us some information on what you've been hearing as well. So council has asked us to do some outreach with our community to make sure that people are aware of the impacts that are going on that have been studied in LA, which our community pretty much matches in most cases what's going on in LA, so we can kind of foresee what could be happening. We're going to be going to council on September 29th with our proposed ordinance. The staff report is going to be posted about a week before. If you will make sure that you sign in and give us your email address, we will send you a link to our website that has all the information on minimum wage, including several studies that were done for the City of LA, an information item that we've written to council summarizing some of these studies, and it will also have videos of the meetings, the 3 meetings that we've had here. You can see exactly what was happening as well as the PowerPoints. Please also give us any information that you have, any questions that you have. If you feel like you haven't asked them here at the end of the day, feel free to ask your questions here, but if you have anything else that you want to make sure we know about, let us know. We're also going to be including all the questions and answers in our staff report to council from these meetings so that they're aware of what the community is concerned about. A couple housekeeping items. Bathrooms are to your left. Drinking fountains are to your left. We do have parking validations. Please, I'll show you who the staff is, and please approach the staff at the end if you don't have a parking validation. Our city staff here today, we have I can't even see, Stephanie Lazicki from the finance department. We have Jason Harris from our economic development department, and we have Jennifer Taylor from our economic development, division. We also have Julie Tarrin and Mark Amaral from our Human Services Division, and we are lucky also to have Nancy Berlin from the California Association of Nonprofits who's here. But without further delay, I'd like to introduce our special speaker today. Ken Jacobs is the author of the well-reviewed report discussing the impacts of a minimum wage increase in the city of Los Angeles. Mr. Jacobs is the chair of the Labor Center, a public service and outreach program of the UC Berkeley Institute for Research on Labor and Employment, IRLE. His areas of specialization include healthcare coverage, the California budget, low-wage work, the retail industry, and public policy. In addition to his Los Angeles research, Mr. Jacobs has consulted with the City and County of San Francisco on the development of the San Francisco Healthcare Security Ordinance and was a member of the Mayor's Universal Healthcare Council. Before he joined the Labor Center, Mr. Jacobs was with the Bay Area Organizing Committee, an affiliate of the Industrial Areas Foundation, where he worked on improving wages and expanding health care coverage for low-wage workers. So please join me in welcoming Ken Jacobs.
Thanks, Gigi. So, good morning. So what I want to do this morning is start out talking about what are the basic coverage in the Los Angeles minimum wage as the model that Santa Monica is looking at. And then go into particularly our study on LA, which gives some basics for understanding what that impact would be, and talk about what would we expect is the impact for workers, businesses, and the local economy, and then move from there specifically into, so what does that mean for nonprofits, who of course face special challenges, talk a little bit about those challenges and about what's been done in other cities to face them, and then pulling into a real discussion. And if there are clarification questions along the way, please do ask. So the LA minimum wage, this has also been passed by both LA City and LA County, which covers the unincorporated areas. Of course, at this point, Long Beach, Pasadena, West Hollywood, Beverly Hills are also considering passing minimum wages. Just to put this in context, there are 26 cities and counties that have done that in the United States, mostly in recent years, ranging from Birmingham, Alabama, to Chicago, Seattle, Los Angeles, San Francisco. It's a pretty big mix. The LA wage, of course, $10 an hour, January 1st, 2016, under state law. In LA, it goes up to $10.50 on July 1st, 2016, and then goes up every July 1st, going up to $15 by 2020 for businesses with over 25 employees, and then is indexed thereafter. And then small businesses and certain nonprofits, there's a one-year delay, again, reaching the indexing in 2022. So in terms of the deferral for nonprofits on that one-year delay, that's for any nonprofit with 25 or fewer employees, just like small businesses. Or if you're over 25, you can seek a deferral. And in order to qualify, you have to meet one of the following criteria. The CEO earns a salary which, when calculated on an hourly basis, is less than 5 times the lowest wage paid by the corporation. So the CEO can't earn more than 5 times the lowest paid worker. Transitional employer, although that was just amended to give an exemption for transitional employment programs. They need to meet state minimum wage but are exempt from local minimum wage. Child care providers are given that extra year. And then any program that's funded primarily by city, county, state, or federal grants, and the regulations as to what primarily means still need to be written. And we'll get into the rationale for those in a little while. So we did this, my colleagues and I did a report for the City of Los Angeles. And just as we go into this, we were looking at a proposal for $15.25 by 2019. So what actually passed is a little bit lower wage and a little bit longer timeline. So the final results will be a little bit less on each of the dimensions than what we talk about it, but it's in the same ballpark and the same general lessons apply. So just in terms of overall coverage, it's for private sector workers only, for-profit and nonprofit. Local cities cannot set wages or standards for state, federal, or school district employees. So, or in-home support services, which is done by a public authority. So all of those are done separately. Also as mentioned, excludes IHSS. And then the data I have, we're talking about, is only about covered workers. So when we look at what share of the workers are being affected, that excludes these public employees. So the basic picture here, when we look at the City of Los Angeles, as you can see, it's quite large, but we're looking at directly affected workers, that is, people who are earning less than the new minimum wage in each of those years, and so would receive a wage increase in order to at least get up to that new minimum. And for the City of LA, we estimated that'd be a little over 600,000 workers and a little over 40% of, a little over 500,000 workers directly affected, a little less than 35% of the workforce. And then there's another 100,000 who are indirectly affected. And what that means is when employers raise the wage up to the new minimum wage, you have a wage compression issue, right? In order to maintain some differential, the supervisor who was earning just slightly more than now that worker is earning is likely to get a wage increase as well. And that is pretty well documented from the research literature, that we do find a sort of an amount of wage push that goes beyond the new minimum wage. And so there, again, we expect in the city of LA another 100,000 workers, which is a little less than 7% of the workforce, and that gives us the total increase. Most of this, the vast majority of it, comes from a small number of industries. Food service, mainly restaurants, are 17% of the share of workers receiving pay increases. Healthcare and social assistance, another 13%. Retail trade, 14%. And then what's in the databases is administrative and waste management services, which has everyone scratching their heads, but that would include temp agencies, janitors, and security guards. And so between those, you've got about half of the workers who are being affected. Overall, nonprofit sector makes up a little more than 6% of the workers who would get pay increases. So when we look at what are the size of those pay increases, again, this was for a slightly higher dollar amount coming in a little earlier. We estimated it was about $2.73 on average pay increase by 2019, $4,800 a year, and a 30% increase in annual earnings. You'll note that if you're talking about a wage that goes up from 10 under state law to 15, the reason that 273, or this was 15 and a quarter, the reason that 273 is smaller than that 5 and a quarter is, one, you've got some wage growth that would be projected to happen anyway between now and then. Two, people earn different wages along that line. It's not like people aren't all concentrated at the low end. In fact, you have a little more at the higher end of that group. So as a result, the average percent annual earnings increase is about 30% for those workers who get pay increases. And actually going back, it's important to note here in terms of who those workers are. They're predominantly in low income families and predominantly workers of color. So this is sort of in terms we look at what is, gives us some sense of the impact overall on workers who would benefit from the pay increase. So what happens to the economy? We raise wages. How is that absorbed? And people have this sort of simple supply and demand model in their head oftentimes that says, well, if you raise the price of labor, people will use less. And economics and labor economics has known for a very long time that it doesn't work that way, because you have to look at not just the demand side, but also the supply side. And labor changes when wages are higher. And so one of the first effects we find in the literature and the research is reduced employee turnover and improved employee performance. I mean, the basic concept here is if you charge more for this pen, the pen isn't going to write any better. If you pay a worker more, that worker's behavior changes. People stay on the job longer, they work better, they work harder, and part of that, when we look at the decline in turnover, people tend to think of it as, okay, people aren't going to leave this job to jump to another job because they're paid better here. That is an important piece of this, but another piece of it is when people are earning very low wages, and they're in low income and are in low income families, that can have an effect on their ability to hold a job, right? My car breaks down, I don't have the money to repair the car, I'm late for work, I miss work, I can lose that job, so problems with childcare, etc. So having low wages and being low income affects the ability for people to stay consistently at a job and in the workforce. And then it is also the case that when you raise the wages up, because this changes in terms of job ladder trajectories, even within elsewhere in terms of the ability of, can I move here laterally and get a pay increase, employee turnover goes down. The research literature says about for every 10% increase in the minimum wage, we see about a 2% decline in employee turnover. This is also well documented, which I'll get to in a minute, in the nonprofit world as well as the for-profit world. And again, metrics on improved worker performance, we see decline in absenteeism, decline in grievances, workers and firms reporting workers are working harder, greater employee satisfaction, even less equipment maintenance and less equipment damage overall. And we estimate that the turnover itself will save employers in the range of about 17 to 20% of the cost of the wage increase, because turnover and training is costly. So then there's the question of, okay, wages have gone up. What does that mean? Are employers then going to buy less labor, even if the performance is better, and switch over to capital, right? Switch over, replace people with machinery. And overall, the research literature on this issue is somewhat mixed on this question of what's that relationship in the labor capital substitution. But when we think about this particular area, the industry with the largest effects is in the restaurant industry. Over the last decade, we've seen the cost of capital go down significantly with very low interest rates. Yet we haven't seen a big switch over into automation within the restaurant industry during that period of time, even as that relative cost of labor and capital changed quite significantly. And I think that's important to see. Dan Aronson at the Chicago Federal Reserve looked at this specifically around minimum wage. They have seen some changes in the restaurant industry in terms of more use of automation in the ordering side, iPads, automatic ordering, but overall employment hadn't changed. That was picked up for in other places in the restaurant industry, and we haven't seen a major substitution there. We may see over time as technology gets better, but that's likely to happen with or without a minimum wage increase. So how is it absorbed? What have we actually seen from the research literature? And the main area is small price increases, mainly in the restaurant industry. That's where it's big enough to actually be able to document. For every 10% increase in the minimum wage, we've seen about a 0.7% increase in restaurant prices, pretty small. But if you raise the cost of restaurants, you would anticipate, and overall you would anticipate some small decline in sales, right, in terms of reduced demand. Overall in LA, we estimated that the full wage increase would raise costs one time in Los Angeles or over that 5-year period by about a 0.5 percentage point. This is pretty small on the scale of the economy as a whole. But at the same time, we have some decline in demand because of higher prices. We have low-wage workers with more money in their pockets who are spending that money in the local economy, which also has a multiplier effect. And so we estimate that those two effects pretty much offset each other. And in the end, we estimated that in the city of Los Angeles itself, there'd be a slight decline in employment, mainly because a lot of people who work in LA in the city don't live in the city, so they're spending some of that money outside. Within the county as a whole, an overall very small increase in employment. But no major change in employment, and at the same time, you've got a very large increase in low-wage workers' earnings. So the basic lesson there, and this comes out of a lot of the research literature on minimum wage, is that the policy works for the people that it's intended to work for. Nonprofits, there's another set of issues that come out. First of all, there's been little research done on the impact of minimum wage on nonprofits. But if you're in a restaurant and you've got a small increase in your operating costs, you can raise prices, and all your competitors have the same price increase, so are facing the same cost increases. They all raise their prices. They can still compete. In the nonprofit world, people receive revenues from a variety of sources, right? You've got your program revenues, governmental contracts, contributions, and how revenue comes in is going to affect the ability to absorb those costs without cuts to services. So overall, though, as we look at nonprofits, this is the city of LA, and Nancy Berlin's looking at this. This looks familiar. We basically took something they did for the state of California and just pulled the LA data using the same sources. So that was easy to do with having the model in place. But the main thing you see here is nonprofits are incredibly diverse, right? A high share of the overall revenues and employment in nonprofits is in healthcare and higher education. That's close to half. Those are areas where they have significant resources, where the labor share of operating costs are relatively lower, and than some of the other nonprofit industries, and the number of low-wage workers and the share of workers who are low-wage is much lower. And at the same time, we also have in the human service areas and some other areas, you have nonprofits that are much smaller and have a higher share of workers who are low wage. So it's important to say just the nonprofits as a group are really quite diverse, and capacity is quite different. Here's the picture for Santa Monica that Stephanie pulled, I guess, over the weekend very nicely. Note that the hospital data for some reason was missing. There was some question about how it was coded. There are 2 nonprofit hospitals, and if they were in here, this would look more like LA in terms of the amount accounted for by hospitals and higher education. Interestingly, where you see the bigger differences in Santa Monica are in terms of a greater share of the overall sector are in higher ed, environment, international, so, and a little less religion. So when we look at overall, I know clue people in the room, you can explain that later. Overall, when we look at the impacts on different parts of the nonprofit sector, it's important to note 30% of workers in the industry are projected to get raises. That compares to 40% for the private for-profit sector, so it's a much lower share. Nonprofit workers make up 8.5% of covered workers, but 6.3% of those who are projected to get raises. Again, it's lower overall. So when we look at specific areas, though, where you see the biggest impacts are in residential care facilities, child care services, and social assistance, you have a higher share of the workers in those areas who will receive pay increases, where if you look at hospitals, it's 13%, much, much smaller. So overall, and to do all of this includes direct and indirect wage increases, employer taxes, workers' comp was all factored into this analysis. But we estimate that overall nonprofit payrolls would increase in LA by 2.4%. Now, Stephanie and Gigi provided some data to me on nonprofits supported by the city of Santa Monica, and I ran these same numbers just looking at those nonprofits off their wage data. Just for the direct impact, what would the wage increases need to be, assuming that things kept up with inflation between now and 2020? And it came out at 2%, almost identical. Now, clearly, if you brought in the hospitals, that would probably lower it a little bit below, but it says that the public data sources that we use for the city of LA look a lot like actual wage data that we had for nonprofits, a set of nonprofits in Santa Monica. So once we factor in the savings from turnover, we'd estimate that payrolls would increase by about 2.1% in LA. Again, the largest are in child care services, a little over 8%, and residential care 7%. Interestingly, again, with the Santa Monica data, it was the same range. The nonprofits with the highest increases were in that 6, 7, 8% range, and then there were quite a few that had no increase at all. On average, payroll costs are 38% of operating costs in the nonprofit sector, so that's more than the for-profit sector overall, which is a little over 20%. When we put this together, we estimated total change in operating cost in nonprofits was a little less than 1%, but this really varies by sector within the nonprofits, given their diversity, and for any given nonprofit agency, right? You're going to see quite a bit of mix here. So where do we see the biggest challenges? One of the big challenges is in nonprofits who are relying on government funding sources. This comes out big in services for people with developmental disabilities and the whole early care and education area. Both of these are places where public reimbursement rates have not kept up with the cost of living in general, and the state has no obligation, or doesn't see itself currently as having an obligation to raise the reimbursement rates in response to local minimum wage increases, or they have not done that heretofore. And so that's a specific issue in those sectors. There's also an issue with government funding about time to renegotiate contracts. There are also, when we look at these sectors, especially in early care and education, when we're looking at both subsidized childcare, but also childcare that's serving low or moderate income families, the ability to raise those prices is difficult in terms of people's ability to pay more in order to access childcare. Transitional employment programs came up big in the discussion in Los Angeles is another area where there were specific challenges. Now, when we think about what to do about this, one reaction would be, well, we don't have an answer for paying for some of these services, so you could exempt them. But what we know very strongly from the literature is that there is a direct relationship between pay and quality of care and quality of service in these industries. That this has been documented highly for services for people with developmental disabilities. We know that wage strongly tracks turnover. Wyoming did a test where they raised wages in developmental disability services and saw a 20% point decrease in turnover. We know that high vacancies and high turnover are associated with lower consumer and family satisfaction and lower employment among the parents of those children with developmental disabilities, because not having the regular services affect people's ability to hold a job. In-home support services, similar results. Wage increase for IHSS in San Francisco dropped turnover about 17% points. And again, well-documented relationship between turnover and quality of care, quality of service. And then in childcare, there's a whole literature on the relationship between quality jobs and quality care, and what that means in terms of long-term for those children's and those children's sort of health and educational prospects. So if you were to exempt these groups, then if the relative wage is lower than the rest of the economy, that makes these problems worse, not better. So when we're looking at these issues, then the question becomes, all right, how do you address these problems that have been raised? One solution, which is done in the city of Los Angeles, is longer phase-in periods for the nonprofits facing the greater challenges, more time to renegotiate contracts. There's clearly a need to address the public funding issues. One discussion that's happened, and I know the city of Los Angeles already did a resolution on this, but one could imagine all these cities in California who are raising the minimum wage, working together in Sacramento to say to the state, these reimbursement rates need to go up to correspond. At the local level, the city of San Francisco both increased, now it's a city and a county, so it covers things like mental health services, raised the payment rates, raised their payment rates to the nonprofits that they fund directly to make up for that difference. And San Francisco, for over 10 years now, has had a program called C Wages, where it subsidized childcare. Originally it was center-based care, now it includes family-based care as well. And those subsidies are being increased in order to cover the cost of the higher minimum wage. So San Francisco basically said, in order to guarantee quality child care, and if we're raising the wage, we need to figure out a way to improve that care in child care. I'm not aware of any others doing that, anyone else who's done that, but I think it's an important program and model to think about in looking at how does one address these issues. The other thing that's important to include in this mix is some process for evaluation and reporting. One of the suggestions that came up from some of the child care groups that we've been talking to was to have a built-in evaluation and report back process. What's actually happened, and looking at this over a number of years. And I know Los Angeles does for the economy or as a whole, But to say specifically on nonprofits and on childcare, what's happening and what measures are being done in order to say, okay, in reporting back in 2-3 years, give it or as you go, it could be annually, biannually, to come back and make sure that it doesn't just drop off the radar afterwards. So that's the basic of my presentation on sort of what's been done and what we know. So far, just in general, the minimum wage laws around the country have generally included the nonprofits. There's been a few small carve-outs here and there that, when, as discussed, some of them have excluded city-funded or publicly funded youth training programs that are, short-term summer jobs programs where the amount of positions is dependent directly on the amount of funding. But for the most part, nonprofits have been included for the reasons I discussed. And as these wages are going higher, we're going to learn more about those impacts in the coming years, and it'll be important for people in this community to really monitor and think about and look at what can be done to make that work. So, questions, comments, discussion?
The workforce that constitutes 17%, and you start at 25 workers per business, which means that there's a whole lot of small businesses that are not going to participate in this. And the question for me is the timing is the one, and the second one, more inclusiveness. What's happening here is that there's a big group of people that are not going to benefit from that.
So the businesses under 25 or 25 and under are not excluded. They're just deferred for 1 year. So the wage goes up to $10.50 on July 1st, 2017, and reaches $15 on July 1st, 2021. So that was designed to give people a little more adjustment time, because both the certain categories of nonprofits, but also small businesses face some more adjustment challenges, and this was designed to give them a little more lead time in order to make those changes. But they are included.
Thank you very, very much. I just want to go on record, notwithstanding all the positive stuff and the gain that's being made. I always felt that $20 an hour wouldn't be unreasonable for everyone, and to really do it so people can really get a good life and be able to do things. I mean, you always see prices going up. Everything costs more, movies, food, but they don't just change the minimum wage. I mean, prices are always going up. So, you were saying that you could expect they would raise the price in a restaurant if the living wage went up. They do that anyhow, all the time. Everyone accepts it. But it's harder for people to get by. $20 an hour is not unreasonable. I also want to ask, is there anything different about the LA County ordinance in the city that affects what is happening in Santa Monica's evaluation of everything that's going on?
So LA County passed basically the same ordinance as the city of Los Angeles. And there is a very big advantage to all the cities in a geographic area passing the same rules. One, it means as employers, you know what the rules are and aren't worried about their slightly different rules depending on exactly where that person is working. And especially if you're given in a small area where you could have people working out of the same office in different cities, that creates a little more complication. So bringing everyone up, having the same rules everywhere is good for employers, and it's very good for employees and for enforcement purposes. In San Francisco, you get on a muni bus, and there's a sign on the bus that says what the minimum wage is. They're all over the buses. It's really very nice. But what that means is workers know what the rules are, and if they're not being paid the wage, they know who to contact and what to do. When you have different rules in different places, then it's harder to get that message out. And that's also true if you have lots of different kinds of carve-outs or different wages for different groups. It makes it harder. And so there's a real, on the enforcement side and cost of enforcement, there's a virtue to simplicity, but there's also a virtue to doing the same thing in different close jurisdictions.
Okay, I'm not opposed to raising and all this, but I think I just want to add some perspective maybe on what some of the challenges are, because we're certainly over 25 employees. And I'm looking at the thing is, it's not an isolated thing to have to just raise the minimum wage. We're dealing with, and as you mentioned, wage compression that comes with that. We have over 80 employees, and that goes up in the summer. At the same time, I don't know if you're aware, the DOL intends to raise the exempt salary minimum in 2016 also. We employ a lot of entry-level management out of college, and we try to encourage careers in the wire, just to prepare them for the business world if that's what they choose. But it becomes very difficult when you're looking at wage increases at the salary level, as well as your minimum wage and the healthcare benefits that recently just is going into place for 2016. So I think the challenge for me is when I look at the 2017 increase, it's a huge, when it's going from 9 to 1050, and then I've got to look at how I'm going to get to the 250 that rate. It just seems a little bit larger increase, and that's not as easy as the other years to get that up.
And just so everyone knows, thanks, what you were talking about, in January under federal law, there's the issues for salaried employees, the law governing who is exempt from overtime. So currently in California, that's twice the state minimum wage, so that'd be $18,000 a year, a little bit more. And then that would have been going up to a little over $20,000 a year next year. Under the federal rules, it'll be $53,000, or $50,000. $50,000. So that means anyone who earns, salaried worker who earns less than $50,000 a year will no longer be exempt from overtime.
Right, and it doesn't require a vote from the Congress. It's simply the DOL.
Right. Yeah,
we'll be able to do that without anybody interfering.
Yeah, this is a regulation, and so that basically, so that means at that point people will have a choice of paying overtime or having people work for 40 hours a week and avoiding overtime.
Right, you have to find a different way.
Right.
Just to comment a little on that, it is a proposed regulation, and there's a lot of debate about how it relates to nonprofits or doesn't relate to nonprofit. It's extremely complicated and may not cover all nonprofits. So before we get too terribly worried about it, we're all trying to analyze it completely, because there's lots of weird provisions about whether you're involved in interstate trade and which part of your businesses are charities or not. And anyway, it's not simple, and we're nationally working on it to unravel it.
And Nancy, do you know when the final reg is supposed to come out?
Well, the comment period ended on the 5th. So there were thousands and thousands of comments. It's going to take them a little bit of time, I think, to sort through it. And a lot of them were from nonprofits to try to clarify how it impacts nonprofits. So I think they will look at that piece carefully.
I just have a couple of clarifying questions. Would the ordinance apply to all employees, both full-time and part-time?
Yes.
And what about interns or stipend programs that are different than transitional employment programs? So in other words, if you have consumers where you pay a stipend, they don't work full-time or part-time necessarily, would this apply to them? Or what about interns that are in training? Like in our agency, we have a lot of mental health interns that are paid stipends. Would it be required for those?
So, both under California and federal law, there is a very narrow definition of what counts as an intern that is exempt in terms of paying stipends, and that has to do with whether or not you are receiving educational credit. And so it is my understanding that if people are not receiving educational credit and do not fit under that definition, then they would be covered.
Sorry, I should have grabbed the microphone when John had it. I'll come over here.
No, it's okay.
So Ken, you referred a couple of times to the transitional jobs exemption, so I'll just flush that out a little bit for those that might not be familiar with it. In the city of Los Angeles, the one exemption that was made to the minimum wage proposal was for participants in transitional jobs programs, specifically like we operate at Chrysalis, Homeboy, or the LA Conservation Corps, where they are essentially training programs of a limited duration where the program participants get a very substantial programmatic benefit through essentially work therapy. And I'm curious from staff if the staff recommendation to the council will include such an exemption.
Well, it's going to count on what council wants to do, but as we had mentioned, whatever LA is doing, we will be proposing very similar terms in our ordinance.
I just wanted to say that I really have a hard time believing that somebody can live in the city of Santa Monica, even now, not even in 2021 or 2020, for less than $15 an hour. And as someone who operates a program to move people into work, what we see is sort of shocking. We're a partner with a WorkSource Center. We work with the LA City and LA County WorkSource Center system. And when we are working with those staff, we're seeing staff that's making minimum wage when we're trying to find people jobs at starting wage in a hotel for $16, $17 an hour, which is making a substantial amount more than even the case managers at these centers. So it's just, to me, this is a basic thing. City of Santa Monica is not a cheap place to live, and it's just, you need to have this kind of thing. I understand a carve-out. I believe in a carve-out for those 18 and under for the summer jobs type programs. We just did a hiring for 2 employees, and it was shocking at what other nonprofits are paying their employees. And they're all, I mean, we had hundreds of job applications for just the 2 jobs we had. So people are just willing to jump ship. They feel they're underpaid, they're not getting this, they themselves are looking at being on government services like food stamps, like CalWorks, because they are not making enough for their families. So that's my comment.
Just a quick note on that. People may have seen, we've done a number of studies on low-wage workers' use of public assistance programs. Child care workers is about 48% that are themselves on one or other form of public assistance.
I understand that the unions are, Los Angeles hasn't settled on the relationship of unions to this minimum wage, because unions are involved with health care and time off and so on. How would Obama's enunciation yesterday saying that all have to address time off would affect this program, and how are you working with the unions?
So on the paid time off, what Obama said yesterday was federal contractors will have to provide 7 days of paid sick leave. California has a law of 3 days of paid sick leave. Other cities, San Francisco, Oakland, a number of other cities have in California nationally have passed their own paid sick days rules, which have higher numbers of paid sick leave. So that is something that cities can, and a number of them are looking at. Some of them have put this together in a package. I believe the city of LA is going to be having a discussion around that as well. I want to get to the union piece, and then you can jump in. The debate that she's referring to there was a question about whether or not you have what's called collective bargaining supersession. That is, that the rules in the minimum wage law can be set aside in a bona fide collective bargaining agreement. And a number of the cities, quite a few of them who've passed minimum wage laws to date, have included, at least most of the earlier ones included collective bargaining supersession. Not all have. And most of the living wage laws around the country, that is, labor standards on government contracts, have included collective bargaining supersession. And the basic idea there is, if the workers as a group get together and say, we want to trade off some of our wage to get pension benefits, better health benefits, and they're the ones who are making that decision in a collective bargaining context, that they should have the ability to do so. Not all unions agree on this. This has been a point of debate. And in LA, currently it's not in there. I understand the issue is still live. It is in a number of the other laws.
And I can put some information in for Santa Monica. Our mayor has asked, as we were drafting the ordinance, to consider putting collective bargaining supersession in our ordinance. And our living wage currently does have that included in there.
I just have a quick question. Are the numbers for Santa Monica going to be online also? You have all these numbers online for the state, right?
So the only numbers we have, for Santa Monica, the numbers we have here are the ones that were produced by Stephanie and by the city. And then I guess, working with my colleague Michael Reich, there were a few other numbers that people were able to pull. The reality is we just don't have the level of data for the city of Santa Monica that we have for Los Angeles, and so there are some pieces in terms of number of workers overall affected, share, and breaking down by industry. You just can't do it that small.
Right, I get that. Is this screen going to be online?
Yes, it will. It's part of this presentation, and we have the PowerPoints, I believe, separated out, so you can just even go into the
Great,
PowerPoint.
thank you.
I was just going to clarify her comment. We have a City of LA contract, and in that contract, it dictates how many sick days we must, at a minimum, provide to our staff.
What is the international line?
So I just wanted to elaborate a little bit more on what California Association of Nonprofits did, just in case any of you want to talk with us more about it. We knew that this was an issue for our members. We have almost 10,000 members across the state of California, and so we surveyed our members last November. And we found a lot of what you see here. All of the concerns are exactly what you're saying and what you see here. And people had concerns about needing to reduce staff, or a lot of concerns about wage compression, whether they had to reduce services, etc. But interestingly enough, a couple of other things showed up. One was that 25% of our nonprofits said that what they would do is just spend more time fundraising, and about 15% said that they would run deficit budgets until they could figure it out. So those are kind of alarming in a way, that second one, but that's something to think about. But the most interesting thing to us was, even after people went through all the different problems that they had and all the nervousness, and people wrote, in addition to answering the questions, wrote us essays and answers. It took us a whole month to sort through them. But when we asked if they could tell us whether they supported increases to the minimum wage, 77% of them said that they would. And so what they were telling us was that they knew it was a problem, they knew it would be hard for them, but they wanted to try to meet that challenge somewhere or the other. And so that's part of what we're working on now. How do we help nonprofits to meet that, whether it's things like lobbying to get more money from state and local government, or if it's even trying to figure out better accounting practices and other internal practices. And if you go on our website, we have a webinar about it this month on September 23rd on just those issues.
What percentage of your members think this will affect them
Well-
substantially.
Well, oddly enough, most of them thought it wouldn't affect them. We're not sure why.
Maybe he's already paying already.
1 second. So the question was, what percentage of our members thought it would impact them? And actually, we were very surprised. 60% thought it would not impact them. Maybe because they're paying more. I have some other theories about it too, but the ones who did were in exactly the same categories that you saw here. They were in childcare, developmental disabilities, transitional employment. Those were the areas where people were most concerned.
Do you have an estimate of what percentage of nonprofits will be affected by this? Do you have a percentage of percentage of nonprofits that will be affected by this substantially? I mean, if it's, you're a small organization and it's one person, it's one thing, but if it's 20 people, it's another.
So we don't have it broken down by share of nonprofits. Remember, there's a huge share. There's quite a few nonprofits who don't have employees. I don't know if they're in your sample.
They are.
And are not affected at all, right? And then you've got some. When we look at where are the employees in nonprofits, a large share of them are in big hospitals, major universities, where the impact is going to be quite small. And so what I think it really is when you get down to this, it is certain sectors within the nonprofit world where the impact is the most, and that's the important place to look.
I definitely want to echo what Jerry had said. $20 is not unreasonable. And also looking at the time chart, for me, I work at minimum wage, and I've always worked for nonprofit, not always, but most of my jobs have been for nonprofits in several different positions. I've been in entry-level positions, program manager, general director, and right now I work for a nonprofit and I receive minimum wage, and because of that minimum wage, I have to receive public assistance. Otherwise, I would not be able to support my family. I should not be receiving public assistance. I should be able to get a decent wage, a living wage. And the fact that we have to wait for a semi-decent wage all the way till 2020, the timeline, even for I don't like it. I mean, I realize that we should give some time for for-profits and nonprofits both, but whether you're a nonprofit or for-profit business, it needs to come sooner than 2020 and 2021. It needs to come sooner. And $20 is not an outstanding, that's not unreasonable.
Any other questions or comments?
Can you go back to the other, the one before? Your charts before.
Which chart?
This one, yes.
Which chart? The
Santa Monica chart.
The Santa Monica. Could you explain the very last column, the average revenue?
So that is the.
What dictates
Oh, are
the
these?
numbers?
Wait a minute. Looks like the titles are flopped.
I'm sorry.
Or swapped. Is that right?
What was the question? I'm sorry.
Explaining the average revenue. I think those two titles. Stephanie, am I right that the titles are swapped? That the first one is.
Yes, they are.
Yeah, those two titles are swapped. Sorry.
We'll fix that when we put it online.
Okay, so the average revenue is that's in thousands. So in arts, culture, and humanities, the average nonprofit brings in $451,000 a year, and has assets of a little less than $1 million. The average higher education nonprofit brings in $7 million a year and has assets of $17 million.
We will double check that.
Yeah.
And make sure that is the case. And if it is, we'll correct it. Any other questions?
Yes.
Oh.
I know that I'm sorry, waiting, I kind of forgot my question. The livable wage in the city of Santa Monica is $15.37. I'm just wondering, was there any discussion of aligning the minimum wage in Santa Monica based on the ordinance? We usually hire our lower level employees in at $15.37.
So, staff is recommending that we, as Mr. Jacobs said, it makes sense to keep, ordinances as similar as possible across the region. So we are recommending going with LA's ordinance. If our council, decides to go up a little further to the living wage, that's a policy call that they will be making. But our recommendation is to keep it at this level at this point, so that the entire community has a chance to climb up together, as well as to maintain this enforcement ease.
So I just want to go on record to say that I'm with Clue, and I understand that there's a lot to grapple with, obviously, and there are some specific questions to be worked out, but we're so grateful that the city is, because this is a very important issue. We feel it's a moral issue to really think past just the numbers, the fact of who these people actually are, right, that are being affected, what that does to affect our community positively or negatively, how we operate together, how we work. So Clue is hugely supportive of these efforts to find an increase, to work together, to work with business, to hold people accountable, right? To make sure that the quality of life is sustained for mothers and fathers is one where all people have dignity, where all people feel respect on the job, right? And nobody should be making these choices of, do I buy groceries or do I keep my lights on at night? And so we just want to honor that and say thank you, and we're here to work with this city in this process. Anyone else?
Well, thank you everyone for joining us again. If you would like any additional information on the status of this ordinance, please give us your email address and we will email you. We have a web page that has all the information that we've talked about today there. It will also be telling you when the staff report is up. And September 29th is the day that we are going to be going to council. So thank you again for coming.
Thank you.
Thank you.